Next up, we'll be joined by 4 subject matter experts for a deeper look at maternal, infant, and early childhood nutrition. And for more on that, I'm pleased to welcome to the stage Johanna Dwyer, Senior Nutrition Scientist at the National Institutes of Health, William Dietz, Director of the Sumner Redstone Global Center for Prevention and Wellness at the George Washington University. Mr. Dietz and Ms. Dwyer are among the authors of the latest Feeding Infants and Toddlers study funded by Nestle. And we have Geraldine Henchy, Director of Nutrition Policy and Early Childhood Programs at the Food Research and Action Center, and Yael Lehman, President and CEO of the Food Trust. The Hill's national political correspondent, Alexis Simendinger, will be leading this final discussion. Alexis?
Thank you, Katie. I've been enjoying being backstage, and it turns out this group knows each other very well, so this is going to be an engaging conversation, I feel sure. Let's follow on what we heard from the earlier panels, our guest from USDA and the lawmakers. And I wanted to turn first to Jerry. Jerry, with your experience at the Food Research and Action Center, we have heard a lot this morning, and we will continue to hear about WIC and SNAP and other federal programs to encourage healthy starts, good nutrition. And I'm going to turn to all of our guests and get everybody a chance to talk about something positive and something that concerns them in their areas of expertise. So it's not going to just be all dour, rainy day, hurricane coming, right? So Jerry, start off, can you give us an idea as someone who works a lot with these programs and the population that depends on them, give us an idea of a trend that you think is positive, and then maybe what's concerning you. We heard some discussion about the public charge policy earlier this morning. Maybe you want to dwell on that for a second. But go ahead and start us off.
Well, thank you very much, Alexis. So it's one of the things that I'm very optimistic about is that we have the power to improve healthy eating and healthy start through the federal food programs. And we know we have that power because research has shown that the federal food programs definitely are a key resource is improving healthy eating. And if we're talking about a healthy start as we are today, about infants and toddlers and pregnant women and new mothers, the 3 programs that are key, of course, and you mentioned 2 of them, are WIC, CACIP, which helps healthy childcare meals, and SNAP, which is the largest program. It's our first line of defense against hunger. So if we look at those, we really see a lot of work going on trying to maximize those programs, access to them, so that everyone who really needs them can get them. So I'm very optimistic about that. So what I'm concerned about is, of course, 2 things, and you raised the issue of the immigrant rhetoric, the ugly immigrant rhetoric that we're hearing, and the proposed rules. So, of course, we heard this morning that is scaring people away from the federal food programs, and that has very detrimental effects, especially when we're talking about healthy start. If people feel like they can't go to WIC, they can't get baby formula, they can't get breastfeeding support and advice, they're not going to get the jarred fruits and vegetables that they need to make that healthy transition. We see in FITS that, a quarter of the kids aren't eating any vegetables, and the kids are eating a lot of French fries. So we need SNAP to help have healthy choices. We need WIC to help have healthy choices. And if people are afraid because of ugly immigrant rhetoric and the proposed rule, then they're not going to get those. And one other thing, and as we talk about, the crossover into healthcare or healthcare costs, WIC reduces low birth weights. So if mothers are afraid of going to WIC, then we have more low birth weight babies. My sister works in the NICU, and so sometimes she sends me some of the care babies that she takes care of, and she loves them. But they're struggling, they're suffering, and that's completely unnecessary if it's caused by people being afraid to use the federal food programs. So I think the other thing that we look at is long-term. So if someone's afraid to participate in WIC or have their young children participate in WIC, one of the things that we really see there from studies is that the long-term impact is on adult health is actually on adult economic achievement and security. So these are really serious implications. So I think immigration is something we're very concerned about, and we really wish that people would tone down the rhetoric, and we're not in favor of the proposed rule to the extent that people know what it is. It's currently at OMB, which does make it look like it could definitely be a serious reality. People don't send rules there unless they intend to move on them. So we really need to stop this. The second thing that we're really concerned about, of course, is the draconian punitive measures in the House Farm Bill, which would push a lot of people off SNAP, would reduce their benefits. And of course, that has a very negative impact on nutrition because really, if you look at the Farm Bill, it's supposed to be helping people through SNAP. If you put punitive measures in there and they can't put food on the table, they can't buy healthy food, they can't get enough food. And that has serious impacts, as I said, on nutrition. So we need to make sure that those draconian cuts in the House Farm Bill to SNAP do not end up in the final conference report, that they never become law. So thanks for the question.
All right. That's terrific. We're going to come back to those topics, I know. Johanna, I had a really lively, nice conversation with you yesterday, and I realized you're an evangelist for data, right? You're
That's
really...
right. I'm professor at Tufts University.
You know data, and you know why it's so important. So I wanted you to reflect on the positive, and if you had a magic wand, what you would like to change, because we were talking about how all of these various efforts, privately, publicly, to gather important health data is so essential to figuring out what works for obviously mothers and children, but also you were also talking a little bit about seniors too, and we might come back to that. But talk about what you're seeing as positive trends in data, and also you're looking at somebody who has experience working on the national guidelines in 2000, right?
Year 2000, yes.
Yeah, in 2000. So we had a chance to talk about the experience of doing that. So talk about data and why it's important and what you'd love to change.
Thanks. In terms of the data, I think somebody already mentioned that the birth to 24 has been added to the dietary guidelines. So we've got to have data if we're going to be able to do a good job in coming up with guidelines for infants and young children. And so the FITS study and also the wonderful work of the National Center for Health Statistics and then Haynes, the National Health and Nutrition Examination Survey, are beginning to get better data on that rapidly changing group of youngsters from birth to 24. So we have to have data. And so I'm delighted that we've got more data now than we've ever had before, and we can go forward. However, there's a lot of things we still need. And Haynes can't possibly sample all of the people that we would like to see, particularly to describe food habits in very young children. And so we need a lot of studies to do that. The government, I know, is doing some work that's very important, I think, in terms of adding questions on complementary feeding to the national population-based study, the Haynes. They're also doing a lot of work to try to understand more about the composition of breast milk and also infant formulas. And also they're beginning to look at getting better data on infants in other ways too. So there's real progress being made, but it takes a lot of work and it takes money and dedication. It's the science base for these programs that are so very important to children, infants, and even people over 65.
Terrific. All right, I'm going to turn to Bill next. Bill, you know so much about obesity in America, and obviously we have a focus through our medical community and, of course, at USDA and these programs on obesity. But I wanted to ask you a question because we heard the earlier panels talk about the importance of communicating. And you said something very interesting in an interview, or at least I thought it was interesting. You were a published interview recently. You talked about the Bloomberg initiative in New York having to do with sugar drinks. And you said that it failed, but it also succeeded, right? It succeeded because it communicated something important to the population about that. So I was wondering if you can reflect on something positive, if that was a good example of something positive, but also maybe what you would like to see us work more on to tackle obesity.
Well, thanks for that question, and let me expand a bit on Johanna's comments. Obesity in this country is still a major health problem. It's kind of disappeared from the radar given the opioid crisis, but we have to remember that almost 40% of adults have obesity, and about 17% of 6 to 11-year-olds have obesity. This is not a problem that's going to go away. And the initiatives have rightfully focused on sugary drinks, like the Bloomberg Initiative. And sugary drinks account for about 50% of the total sugar intake of Americans. And one of the challenges is that young adults in the 12 to 19-year-old age group, about a quarter of them are consuming 500 calories a day in terms of sugary drink consumption. So it's quite appropriate to focus on strategies to limit sugary drink consumption. And the initiative in New York City was one of those, which tried to regulate portion size and was thrown out of court. But Tom Farley, who has succeeded Tom Frieden, I guess commissioners in New York have to have those two initials, TF, that pointed out that when you look at the awareness of sugary drinks and their purchases, they declined precipitously after that initiative, despite the fact that the initiative failed. And we are seeing a number of communities across the country that have initiated excise taxes for sugary drinks. But industry is fighting back. In California, they've preempted local control of taxes, and I think that's likely to happen elsewhere. This is the same tactic that the tobacco industry has used. So on the one hand, I'm concerned about the national data. In contrast to the adult data, there is a plateau in 6 to 11-year-olds, or more generally 2 to 19-year-olds, but specifically in 6 to 11-year-olds. And we actually saw a decline in the prevalence of obesity in 2 to 5-year-olds in the last 4 years. Then the most recent data are a bit different. But that may be attributable to changes in the WIC package, because the biggest changes occurred between 2010 and 2014, coincident with the introduction of the new WIC package, which restricted the amount of juice that could be purchased and reduced the fat content and volume of milk. Coming back, the other piece of information that I think is worth sharing is that I think it's quite appropriate to be concerned about early nutrition in the 0 to 24-month-old. And there are both hopeful signs and not so hopeful signs in that group. Breastfeeding is continuing to increase, but the rates of exclusive breastfeeding have not moved very much. And there are distinct ethnic differences in the persistence of both the initiation and persistence of breastfeeding. The other concern is that I've come to think that formula feeding is a marker for other adverse dietary conditions. So if you look at the FITS data in the 0 to 24-month-olds, complementary feeding start earlier in children who are formula fed as opposed to children who are breastfed. And sugary drinks continue to be a problem across that range. About 10% of children 0 to 11.9 months are consuming sugary drinks, and that increases to 30% of the 1 to 2-year-olds and up to 50% of the 24 to 48-month-olds. So that's a concern, because that early introduction of sugary drinks may precipitate or contribute to obesity, as well as the early introduction of complementary foods.
Well, can you pick up where Bill left off? With your experience at the Food Trust, you've reflected on what works. You've talked about what's worked in Philadelphia. And I think just a few years ago, talking about a study in which it was established that the rate of obesity had dropped, right?
That's right.
And so can you talk about the experience on the ground as a nonprofit, what you've seen that works to tackle obesity? We're talking about, obviously, young people here, mothers, all age groups, really. But what you've seen that works at that level, and then maybe what you're most concerned about from being on the ground.
Sure, I'd love to talk about this. And so our nonprofit, the Food Trust, is based in Philadelphia. We do work nationally. But we started in Philly, and we continue to do lots of boots on the ground programming in Philly, things like running farmers markets in low-income neighborhoods, bringing grocery stores into low-income neighborhoods, doing nutrition education in schools, and a variety of different sites. We worked on the soda tax in Philly. Actually, when you were talking, I was flashing back to testifying in front of city council, and there was all these union guys, the guys that deliver, the delivery guys, and having to walk past them as they were kind of like muscling up against me. It was very intimidating. So the first Mayor Nutter in Philly tried to pass this tax unsuccessfully, and the Food Trust worked with the American Heart Association and others to try to make that happen. Mayor Kenney now successfully pushed it through, and we are seeing. It was interesting, actually, just as a sidebar, is that we learned from the first campaign that leading with health or obesity concerns was a losing message. What we led with in Philly the second time successfully was talking about the money going to parks and early childhood, to daycare and early childhood education, and then health was sort of the follow-up to it. But yeah, in Philly, we have seen a drop in childhood obesity rates. What's also interesting about Philly and why people are looking at Philly is because it doesn't have the same racial, ethnic disparities in those numbers. And also, so people will say, what's the difference? Like, what's happening there in Philly? And I do think that things like the soda tax do help these things. We also banned soda from schools in 2004. We led the campaign to just the vending within schools to ban soft drinks, which I think also helped a lot. There's also, I think, an integrated approach that's happening in Philadelphia. As one example, and we were talking about Gary Foster, a researcher that we both know very well, but we partnered with the Center for Obesity Research and Education over many years, but we were able to show that we were able to reduce the number of youth becoming overweight by 50% in North Philadelphia by doing nutrition education, by by increasing healthy food access, and by also having incentives. And I think when you combine all of these things, you can see some pretty dramatic results. So that's on the positive side. But I do have concerns as well. As Jerry was talking about, I'm really very, very nervous about the administration putting forward this message of fear around receiving basic public benefits, food assistance benefits like SNAP and like WIC. The National WIC Association has even come out saying that immigration custom, the ICE has come out and even will park themselves in front of WIC offices. So there's this real fear right now that you have to choose between immigration status and healthy food for your family, and that is something that I'm terrified about. Without these basic supports, then it all goes to hell. So. Anyway, on that note.
Okay, that was the hurricane comment, yeah. Get ready, if you all get your questions together, I know you want to have a chance to ask these terrific experts some questions, and we'll turn to you in just a couple minutes. If you raise your hands, we've got microphones, and we definitely want to make sure we have time. So we're going to ask one more question, and then we'll dive into your questions from the audience. Johanna, or anybody here, can you help explain? I have to pay a lot of attention to President Trump's tweets. And he tweets about everything. As you know, there's a tweet for everything. But in July, he tweeted something about nutrition, and it was interesting. His tweet was, the U.S. strongly supports breastfeeding, but we don't believe women should be denied access to formula. Many women need this option because of malnutrition and poverty. And we heard Brandon Lips reference something about the importance of breastfeeding. Where did this tweet come from? Does anybody have an answer to this question?
Do you know, Bill?
No? Do you have a guess?
I'm sorry, I don't know.
No? Jerry, do you have a guess?
No.
It's interesting, isn't it?
I know. I
you have to get to the
absolutely
bottom
don't know.
of it.
I mean, the WIC program really has pretty good rates in terms of breastfeeding. It's about 38% are breastfeeding mothers on the WIC program, and sort of about, half of those are fully breastfeeding and half of them are partially breastfeeding. So when the new food package was redone, as Bill was talking about, it was restructured really to support breastfeeding. because they really enhanced the package for the breastfeeding mothers and put a lot more food in there and really tried to change the whole structure. And it did, in addition to the fact that the WIC nutritionists are really gung-ho on breastfeeding.
Great.
You know, so, and one of the technical things that they do actually, in answer to the question your colleague asked, is because they're millennial moms, they don't actually always like to get on the phone and show up. People who have millennials might know that. So what WIC is doing is texting. So it's text support, so you've got someone you can always text about it if you want. You could call them if you want, but you can text them. Yeah. So.
But aren't we waking up every morning? Where did that tweet come from?
Well, I was going to say, like so many other things, who knows, and where the president's tweets come from. It's not about poverty. The availability of formulas for mothers who have difficulty breastfeeding, which is not an uncommon problem, and emphasizes the need for better breastfeeding supports, like baby-friendly hospitals, like lactation consultants. But for those women who are unable to nurse, formula is an essential element of infant nutrition.
Or adopt it if you've adopted.
And both are available
right here
in
in the
WIC.
front. If we can get a mic to you, right here. I'm glad to see all these hands.
Hi, Lucy Sullivan. I'm the Executive Director of 1000 Days. I do know where the tweet came from, if you would like to have information about that.
This is called reporting.
So there was a front page article in the New York Times about the U.S. government, the Trump administration's reported bullying tactics at the World Health Assembly around a breastfeeding resolution. The resolution itself was very uncontroversial. However, it became controversial when reportedly the Trump administration used strong-arm tactics against Ecuador, which was the country introducing the resolution, to try to kill the resolution. And the resolution, all it said was it's important to support breastfeeding. The World Health Organization has a series of new guidance documents for countries to take a look at, and you know, it was a very sort of plain vanilla resolution. So it begs the question, why was the Trump administration up in arms about this resolution? And we believe that it was a lot of industry lobbying around the resolution to try to basically kill it, which leads me to the question I want to ask this esteemed panel about the role of industry in the dietary guideline development process. Would love your thoughts on what the appropriate role of industry is in the guideline development and even dissemination, understanding that Nestle and there are other industry partners that are very involved in the dissemination of the dietary guidelines.
Great. Anybody want to dive in?
Well, I can speak, and I think Bill was on the panel too. I was on the year 2000 guidelines, so it was a long time ago now. But we weren't influenced at all by industry. It was really a very clean process. The issue of dissemination is a different one, and I think we need everybody to disseminate the findings, public, private sector, and voluntary sector, and without more than government disseminating guidelines, they're not going to go very far. So there is a role, but it certainly isn't in formulating the basic science advice. That's a science issue that is best dealt with by scientists.
And I was on the 95 Guidelines Committee, and there was no role for industry. And I think, I do think that industry does bring something to the table and should be represented. That challenge is, how do you address the conflict of interest? So that, for example, the American Beverage Association has no place at that table, in my opinion, because they're just so embedded in their kind of promotion of sugary drinks. On the other hand, there are industry people who have a very balanced judgment of the role of industry and deservedly need to be represented. So I think, and given the complexity of the appointment and how late we are in appointing the members of this committee, that's going to be a real challenge. And it'll be interesting to see how HHS and USDA resolve this in terms of staffing that committee.
All right, we had another question. Anybody else want to? Oh, yes, right here. There's the microphone. Tell us who you are.
Thank you. Thanks for the panel. My name is Li Yang. I think everybody since you just said eating healthy and education and access. And we know the science is important, but important is for people to be aware of that, especially mothers who for the infant age, mother probably is the most important. And if you have breastfeed, it's get closer and also. And in the early age, you also affect in the future. So I think the most important thing is to keep the mother healthy, keep the family happy.
Do you have a question?
So my question is, can you do this direction, keep the mother happy and family healthy and happy? Because nowadays, a lot of people sent to jail. Mother sent to jail. So how do you take care of the baby? Second is
Okay,
now.
well, let's give them a chance
No,
to
no,
answer.
no. You're talking about.
Sorry, let's let them answer the question.
Yeah.
Jerry, do you have any information about what we're seeing among some of the interesting demographics when we're talking about mothers and the differential that we're seeing in some of the concerns that we might have in the data?
Right, I think I would certainly agree if we want to improve healthy eating and give people a healthy start, we do need to take account of these special populations. And so one that you mentioned is incarcerated mothers and the increase there. And what we really want to make sure that we understand in terms of the federal food program supporting them, WIC and SNAP in particular, and also CACFP, is that we allow, so say grandmothers got the baby, grandmothers got the young child, which is common, we make sure that they can participate and they can participate easily. We don't require formal guardianship because it's often not transferred, but they are the guardians. So you want to make sure the guardian program works to help them. You want to make sure other kinship care is recognized and can participate for them in WIC and can participate for them in SNAP and can enroll them in the child and adult care food program. So those are some of the key things that I think if you're talking about incarcerated mothers, because it really is an issue. And I think the programs have to reach out. They have to make sure foster grandparents, kinship care, really important.
Well, thank you very much. We have exhausted our time, and I want to make sure we let our panel get back to their busy days. Katie, I'm going to turn it back to you, and we're going to exit. And thank you all very, very much. Give them a hand.